Well, hello everybody, welcome back to Four Lights Wellness. My name is Omid. In this video, I'm going to show you one really awesome Feldenkrais move that covers a lot of bases. We're talking hip control and stability. We're talking lumbar spine pain reduction and mobility. We're talking about getting all the way up to the diaphragm and getting your breathing right. Where I learned this was a guy named Feldenkrais a long time ago. I wasn't there, he was, but he taught a lot of amazing things about the body. To show you this, I'm going to kind of roll this up so you can see my belly button. And I'm also going to put my shorts right on top of my pubic bone, right at the hips themselves. The way we do this, we take one leg straight. And one key thing that I see a lot of people do with this move wrong is they let this leg completely go out to the side. I don't want you to do that. I actually want you to keep this leg just slightly active and engaged and turned in. I'll cover that in a little bit why. But what we're doing with this is we're trying to coordinate, trying to get the integration into the actual brain itself on how the pelvis, the leg bone, and the lumbar spine actually move together. Here's how it works. This ankle, roughly around where the knee is, somewhere underneath the hip. All I'm going to do is I'm going to push my heel down into the floor. I'm going to do it really slowly. You'll see my belt line tips backwards just a little bit. For you nerds out there, that's the ilium itself going posterior, but I haven't done anything at the belly button yet. Remember that belly button, roughly around lumbar 3 or L3, we're just trying to get the ilium to move just a little bit by itself. And here's what I want you to do with this exercise. I want you to get rid of any judgment on what should happen and just focus on what does. Because a lot of times what happens is people start using their abs to try and do this. Or you remember that leg I was talking about? Sometimes when people push this leg down to the floor, the other one rotates out, almost as if it's the other leg that's trying to move the pelvis rather than just this butt. So I'll do that again. I'm going to keep this leg slightly active and in, and I only want to get just a little bit of that pelvic rocking backwards. You should feel the glute engage. And if you don't, stay at this level. Don't go any higher, because then you're just going to start developing bad habits. The next rep, we're going to move the ilium again by pushing that foot down to the floor, get that little posterior tilt, and now I'm just going to keep going until I start to feel a little teeny tiny bit of movement at the belly button. Not much, but what that means is that my L5 right above the ilium has now started to rotate just a little bit, going into that flexion pattern, which is what we want. I return back, completely relax in between every rep, re-engage again, pushing that hip down. Now it's the ilium and L5, and now L4 is going to start moving. I can already tell this hip's a little tight because I'm starting to feel some stretching in the front of the actual capsule itself right through here. So I'm going to make a mental note of that. I need to stretch this out or foam roll it or massage it or do something through here. But like I said at the beginning of the video, this is not a stretch. This is not an exercise. This is a neuromuscular coordination exercise and some mobilization. So you're not going to hold this at any time. You're just going to push that heel down, get the ilium, L5, L4, and now the belly button's really going to start moving. You'll see my back flattens into the ground. My abs are nice and soft and relaxed here. And I go high enough that now L3 starts to move. You're going to keep doing this basically about 20 plus times to get through the entire spine. Eventually, you'll be rotating so much with this leg that you land on your face on the other side, making sure to keep that leg active, not cheating and compensating with stuff. Some people will start to notice their shoulder starts to come up a little soon. Relax. We're trying to work this rotator cuff, not this one. I'm going to skip forward a little bit because I don't think you guys want a half-hour video on this. But I'm going to push that heel into the ground, and I'm just going to feel and observe and the quality of this movement. It should be segmentally going up just because everything's connected with stuff. We got skin, we got muscles, we got fascia, we got all of the connective tissue and things, but it should be sequential from the bottom up. And all I'm doing is I'm just pushing that heel straight down. One thing that starts to happen for a lot of people is the inner thigh starts to pull the knee across so that we can use our tensor fascia, a lot of the flexor on the outside, to pull rather than just glutes, extending that hip into the ground. So if you want, you can actually keep a hand on that butt muscle to make sure that that's really the one that's actually doing most of the work. And then inside of the pelvis itself, like I said, we have a rotator cuff inside of that hip joint that should be doing a lot of work. As I go up and through here, now I'm starting to get that rotation up into my diaphragm. I can tell my left leg really wants to turn out. I'm not going to let it yet. I'm only going from here. Once I get most people to about the ribs starting to turn, it's about all I need. There's only a couple rare cases that I'll really have people keep going through here until eventually the spine is actually rotating so much that the shoulder is connected by a bunch of stuff. It just starts to move with the body. On the way back down, we're going to reverse this. I want to make sure that everything is coming back from here, top down. Some people like to come straight back down with the hip. I don't like that. I want to keep this glute engaged and then start to roll back down one bone at a time to get through this. Now I'm going to do this on the other side so you can see the full roll. I'll go through it a little faster. I get that knee and the ankle roughly in line. Because I'm going to do the full roll, I'm going to take this arm that's in the way out of the way, somewhere up there where it doesn't matter too much. But I'm going to do the same thing, pushing that heel straight down to the ground. I should get that ilium to rotate backwards. And then I get L5, L4, L3, L2. Right about here, I can tell that this adductor wants to pull me across. I'm going to try and rotate it in to give it another job, distract it so it doesn't do its job. I can also tell this adductor wants to pull me across. I'm going to push that knee out to the side slightly so I can get more glute medius and minimus. I'm going to go through this a little faster so you can see what ends up happening. I'm going to flop this arm out, look straight up, relaxing the neck. And as I go through this, you'll start to see the rib cage rotates just again because it's all connected. What eventually happens is I get so much extension out of this hip that it's rotating my pelvis a lot, getting my rib cage, my arm. Eventually the head starts coming with this and I push down so much that I just start to get pushed into the roll. Eventually you extend so much that you start to flop onto your belly. The most important thing, a lot of people tend to get stuck here and they try to pull this leg across and use the weight. Different exercise. Really try to get these rotators and extenders active. Eventually, I just start to get body weight and gravity winning. And now I'm eventually onto my belly. If you do want to reverse this, it's the exact same thing. I'm going to use that glute extension, coming across. And just because everything's connected, I can come back through. And now from here, I'm going to start to try and get the head down first. And now I'm going to go through the cervical flexion, thoracic flexion, getting everything to touch the ground from the top down. And eventually now I can unwind that pelvic flexion into a neutral hip. You don't need many of these, right? You can do one sequence of this, literally every single bone, taking about 2 to 3, maybe 4 seconds each. It might even take 2 or 3 minutes to get through one full side, and then you move to the other one. Maybe 2, maybe 3 times per side, and then call it a day. This is not something that we are going to do hundreds and hundreds of reps of. This is a very neurological coordination exercise. And once you remind, right, remind that pattern, you're pretty set. So if you have a big heavy deadlift day, for example, this is a great one to do the night before or right before to kind of just warm up this pattern of getting that glute extension to finish that deadlift. Maybe a squat day, maybe a lunge day, anything that's going to use that lower spine and pelvis. Or if you're like some of my clients, you get that kind of nasty, irritable hip kind of friction pain inside of here, that kind of pinching that happens. Well, a lot of times that's because there's too much friction at the leg bone going into the pelvis and not enough movement at that lumbar spine and ilium. This tends to help clear that out a little bit, but I do want to mention last thing in this video, If doing this causes the pain to get worse, especially with each actual rep that you're doing, do find some people, the first rep might be a little, I don't know, irritable, and then as they go through, it actually gets better. That's awesome. But if you do have a fully degenerated hip in there, this is going to suck. Please don't do this. Revert back to one of the other rotational exercises we covered earlier in the sequence. But that's it for this video. I hope this information is very helpful to you guys. As always, have a happy and healthy rest of your day. I'll see you in the next one. Oh, and real quick, if you like this exercise, it's actually included in my latest course on fourlightswellness.com. It's called the Movement Reboot. This and a whole bunch of other sequences that really reprogram the brain to get your movement back to where you want it. We'll see you soon.